My name is Erik Blutinger, and I'm an assistant professor of emergency medicine at the Mount Sinai Health System. How can you keep cool when it gets very hot during the summer? Make sure that you monitor time in the sun, apply sunscreen, wear loose-fitted clothing, and don't be in closed, hot spaces, including your vehicle. Within the matter of just a few minutes, you can get very hot inside a vehicle, and so we always advise patients to be aware of your surroundings, especially your loved ones, to prevent anyone from getting too hot during the summertime. People who are most susceptible to overheating are the elderly, the young, especially the infants, those working outside, and those traveling in the subway. In the emergency room, we often see people who come in seeking medical treatment for overheating, especially in the summer months. Fortunately, we have the medical tools available to us to take care of you carefully and safely, but it is always best to be aware of your surroundings so that you don't get to the point where you do need medical treatment. Heat stroke is a very scary, true medical emergency and is often universally fatal if left untreated. It is the most serious presentation of heat-related illness, and it's marked by very high temperatures, those over 40 degrees Celsius, and most often accompanied by other deficits such as confusion. Early signs of general heat illness include having cool, moist, pale, or even flushed skin. You can also have headaches, lightheadedness, or even weakness, among other symptoms. You should seek medical care, especially when you feel as though you are having a true life-threatening emergency. Generally, what I advise my patients and family members is to, if you are starting to feel lightheaded, dizzy, having headaches, feel hot, put yourself into a cool environment, drink plenty of fluids, rest, and see how you feel. And if you feel as though you are not experiencing improvement after taking a few concrete steps to get better, then I would certainly consult a medical professional and consider going to the hospital, if not contacting your doctor. It can be very tricky to tell the difference between sunburns and heat stroke because oftentimes both processes overlap one another. Sunburn is usually marked as very mild irritation or blisters that can be treated at home and with a few topical creams and ointments. But a sunburn can lead to a heat stroke because a heat stroke usually will be accompanied by not only a rash, but also fevers or chills, nausea, vomiting, and possibly confusion. In the summer months, to avoid overheating, you can certainly take concrete steps that we've talked about. Staying well hydrated, being in a cool place, staying out of direct exposure from the sunlight, wearing loose-fitted clothing. But keep in mind that New York City has wonderful resources that are available to all of us. For those who do not have an air conditioning unit and may struggle financially, there are resources such as the Home Energy Assistance Program. You can also call 311 or find a cooling center in New York City during a heat wave, which can be found on the website. And there are a few other concrete initiatives that are underway across the city to really prevent many who live in the city from becoming overheated and experiencing a true heat-related emergency.